at the Children's Medical Center in Los Angeles. We count David as a great partner and friend and advocate for children and teens and families coping with loss and change. And his great work has really been beneficial to all of us across the country. And we're very happy that he's extended his time to us today. So David, we'll let you take it away.
Okay, well, thank you. So what I'm going to be talking about today is really how to help students and yourself cope with crisis during this pandemic. And there's going to be a second webinar in 2 weeks where I'm going to be focusing more on how to support grieving children and families during the pandemic. But for this webinar, we're going to focus on really how do you provide psychological first aid? What are some of the common reactions to a crisis, in particular to a pandemic, that you may be seeing among children? And I may, for the purpose of this, refer to them as students. I should also say that when I refer to parents, I'm really referring to any adults that are helping to care for children, whether those be parents, aunts, uncles, grandparents, guardians, other caring adults, but I'll just refer to them shorthand as parents. I'm going to talk a little bit about what we might expect when schools do reopen, assuming that reopening may be sometime around the fall, for example, in September. And then I'll talk about helping children cope with the pandemic and spend some time on professional self-care, because we have to make sure we're taking care of the adults who are taking care of the kids. So the first thing is on what's referred to as psychological first aid. So in the immediate aftermath of a major crisis event, you really want to provide psychological first aid broadly to all those impacted. And it involves offering what we call psychoeducation, which is really just making sure that we're giving information to help people understand the impact of crisis on them and what they can do, what are some common strategies that they can take to help cope with that. So in addition to psychoeducation, you're also providing supportive services, and the goal is to promote effective and normative coping strategies and adjustment. What you're trying to do is just accelerate the natural healing process. So this is a more of a population-based intervention. It is not a treatment. So you're not looking for individuals who are having distress or problems. You're offering this very broadly. And the point that I want to make is that all adults should understand the likely reactions that you're going to see to a crisis event and how to help children cope. Because the reality is that anyone that interacts with children can be a potential source of assistance and support. But if they are unprepared, particularly if they appear to be disinterested, they may actually become a source of further distress for children and adults as well. You know, I was doing some training for the Flight 93 memorial staff outside Pittsburgh. This was the area where a plane had downed on 9/11 that was en route to Washington, D.C. And the passengers and the staff on the plane became aware of the crash that had happened in the World Trade Center and knew that they had terrorists on board the plane in the cockpit. And so what they decided to do was to sacrifice their lives and to down the plane intentionally before it reached its destination. And so outside Pittsburgh, in this rural community where the plane crashed, they created the Flight 93 Memorial, really in recognition for their, their selfless act to bring down the plane to save others. And I was doing training for the staff because they have a visitor center there, and they also have a large national park. And after I had done the presentations, I did talk about psychological first aid and making sure that everyone was trained. Someone came up who represented the groundskeepers, and they told me that they actually had trained the groundskeepers that they needed to stop whatever they were doing when they saw visitors. So if they were in the middle of cutting the lawn, they would stop cutting the lawn, establish eye contact, and ask the visitor, was there any way they could be of assistance? And the person who told me that said, you know, we're not just here for the grass. This is really sacred space, and we're here for the visitor experience. Now, if you can train someone who cuts the lawn to do that, then you can, in the National Park Service, you can certainly train anyone who works in a school property or anyone who works in a mental health agency or in obviously a bereavement center, that they are all there for the children's experience. And so they need to stop and pause and make sure that the kids and the staff are doing as well as possible. So you want everyone to have that orientation. And as it turns out, the support professionals that you have in school, whether those are cafeteria workers or whether they're custodial staff or maintenance staff or whether they're or bus drivers, they all play an important role to support students, and we need to make sure that they're skilled have some of those skills to be able to provide that kind of support in the aftermath, particularly of a crisis. So I remember doing a presentation on how to support grieving students for bus drivers in my school district. And one of the bus drivers just asked, how am I supposed to support grieving kids? I have a bus route that I do. And one of the other bus drivers spoke up and said, well, we can do it. And she said, the other day I dropped off a group of kids at the middle school. And as one of the kids was walking by, I said, could you please stay after everyone's gotten off the bus so that we can chat? And she just looked at him and said, you know, I heard your brother died recently. No kid should ever have to deal with that alone. Can you promise me the first thing you'll do when you go into the school is to ask to speak to the school counselor and say you want to talk about it and get some help? And she said, and the kid said, I will do that. And she said, we can make a big difference. And so you really want everyone in the school to be able to do that, particularly when there's been a major event such as the pandemic, and you have reason to believe that everyone's going to be impacted by it. And we also find that not only can everyone do it, but some people will have a different kind of sense of information that they can get from students and different relationships with them. So they may connect with the cafeteria staff in a different way, or the custodial staff or the school resource officer. So all of them have different observations that they bring, and they see kids in different ways, and they may also connect with them in different ways as well. So I'm going to go over the psychological first aid steps, but those of you who are more in school mental health positions, for example, you should know that these PFA actions, these are as described by the American Red Cross, are actually intended for people who often have limited mental health training, and they're interacting with individuals that they don't have an ongoing relationship with. It's often with strangers, they're meeting with them in public, and they're having brief interactions of about 10 to 15 minutes. But you can use some of these same strategies, even if you have an ongoing relationship. So the first one is observational awareness, and I'm going to go over some of the common signs that you may see of distress in individuals after a crisis. You then want to make a connection, help people feel comfortable and at ease, and be kind, calm, and compassionate. People often pick up on what we call the affective tone of how we're speaking, much more than they actually pick up on what we say when they're particularly distressed. I had the opportunity to go to the first oncology visit with someone who worked with me. She had found out she had cancer, and she was going to meet with the oncologist for the first time. And she brought her husband and also asked me to join her. I thought the oncologist did actually a very nice job of explaining what the situation was and what treatment was required. And the session took an hour. And then after we walked out of the session, she just looked at me and said, so I don't have cancer. And I just looked at her and I go, what do you mean you don't have cancer? And she said, well, I don't think I have cancer. And I said, you just gave permission for surgery to remove your tumor tomorrow. And you also signed permission to start chemotherapy afterwards. And you just met with an oncologist for an hour about your cancer. Why would you think you don't have cancer? And she just looked at me and she said, well, he seems so hopeful. And I said, yes, he's hopeful that you'll be cured of your cancer. And she ultimately was. But I said, you do have it. But all she picked up on was the tone of the conversation. And that's what happens when people are really distressed. So we need to keep that in mind, that if we're trying to be reassuring to people, we should have a reassuring tone. So be very conscious, not just of what you say, but how you deliver that message. You then want to assist with basic needs. And so you're going to want to make sure for kids in this pandemic that they have access to food and they've been eating regularly, that they have a place to live. We should not be taking for granted that anybody is in a stable situation. We actually should never be taking that for granted, but particularly after a crisis, we should not. And so you want to assist with basic needs. I was visiting New Orleans after Katrina, and it was a couple months afterwards on one of the visits, and someone told me that they were in church, and the minister was in the middle of the sermon, and someone's cell phone went off, and people in the audience made some noise, some rumblings about how inappropriate it was to have your phone on, and the minister stopped the sermon, turned to the congregation, and said, that call might be your contractor, you better take it. And so basically, he communicated that literally the word of God is not as important as making sure you're safe and you have a place for your family to live. And the person who told me that just said, you know, my minister really gets us. And that's what you want in a school setting or in a clinical setting, is that everyone who's there feels that their basic needs are important, not just to them, but to other people. So helping kids find food, helping families find access to food, for example, is often the first step of recovery and is an important mental health intervention as well. So we can't just counsel people, we actually have to help them with some of their basic needs. And I know most schools recognize that, and we should be recognizing that every day. Then you want to listen, and you want to be able to actively listen. And sometimes really just listening well is more important than what you say. And so we have to make sure that we're doing that consciously. You want to give realistic reassurance, but not false reassurance. And I'll come back to that later. You want to encourage good coping, and I will review some of the effective strategies for coping. And you want to help people connect. So help them identify supports in their family and their community, and also help them figure out how they can help others. I will review more of this later, but you want to make sure that you're helping kids figure out how to continue the conversations that you may start in your 10-minute interaction. Remember, psychological first aid is intended to be delivered by strangers who will not have an ongoing relationship. So you're not trying to provide counseling, you're trying to connect them with other people who can continue the conversation after you're no longer interacting with them. But if you're the social worker in school, obviously you might refer, you would want them to think about who else they can talk about at home and within their family, but you might be in the position to provide some of that ongoing support. And then you want to give accurate and timely information, particularly as a crisis is unfolding. But one of the points I want to make about that is during this time, we really all need to watch our media consumption. So you want to make sure it's a healthy diet and you don't consume too much. So adults should try and keep informed through focused but periodic attention to trusted media outlets and other trusted sources of information. You don't want to listen to, watch, or read continual media coverage, even though I know it is quite available, because the pandemic is going to be here for quite some time and everyone's just going to get overwhelmed and exhausted if they try and keep up with all the information. And anecdotally, that is what I'm seeing at this point in the pandemic, is they're talked out about it. Like they don't want to even follow what's happening. They just want to pretend it's over because they're exhausted. And so there's a certain amount you want to watch your media attention and inform. One way of looking at this is there really are two main reasons to listen to, watch, or read media coverage during a crisis. One is to be reassured, and the other is to learn practical steps to keep yourself or those you care about safe. So if you aren't getting more reassured and you aren't learning practical information about actions you need to take, then it's time to disconnect from media, whether that's television, radio, print, or social media, at least for a period of time. So you should advise children to do the same if they're not becoming reassured by what they're listening to or learning something that they need to act on, then they're not getting value. So just being informed, just being sensitized is actually not helpful. So this is really a good time for everyone to unplug and then connect instead, whether it's in person or virtually, with family and friends. And it's going to allow parents to focus their attention on children's needs, and it will allow them to provide, and to a certain degree, receive support from their interaction within their family and friendship network, even if it is virtual. So the last two steps on here are to suggest a referral resource. So if you're not providing those resources yourself in your school and in your community, find out what they are and help refer. So for example, if people are asking me, what do you do around bereavement support in your school? And a lot of what I'm telling them is you would find out who are the ones who are bereavement centers that provide services. You'll hear more about Adam's Place at the end of this presentation before we go to questions and discussion. But refer to those resources to provide the ongoing support, particularly if it's, I would do that even if you have internal capacity, because the reality, to be quite honest, is you're going to be pretty overwhelmed with what you're trying to do. And so if you have good community resources, please make people aware of them. But also, some individuals will prefer to get services in school, and some will prefer to get it in the community. And then, of course, some of your community resources can provide school-based services, and you'll be hearing more about that as an example for Adam's Place. But you want to suggest good referral resources in the community. And then the hardest part is to end the conversation. So if you're doing psychological first aid, as I said, you're supposed to do it in about 10 minutes. So you can imagine the hardest part. Well, the hard part is to establish the relationship. The harder part is to end the conversation once you've established the relationship. So you really want everyone to know how to do this and to be aware of the needs of kids. But the reality is that parents and other adults that support children, such as classroom educators, tend to actually underestimate the distress they're going to see in children after a crisis situation, especially when you're asking them to estimate how they feel. I think we do reasonably well, not everybody, but most people do reasonably well at times, observing the behavior of children. That's how they act. But we really can't observe their feelings. So we have to talk with them about it. This was one of the posters that they used in New York City about 6 months after 9/11. It was put up by Project Liberty. And it had the same tagline, if only the signs were this easy to read, because it isn't that obvious how children are feeling. We really have to ask them because they may actually withhold complaints about how they're reacting because of concerns that the reactions are abnormal or at the very least inappropriate. Or sometimes they're just trying to protect their parents and other adults who are visibly upset. And adults, including classroom educators, often avoid discussion of troubling events in order not to somehow contribute to student distress. And they're afraid they're going to upset children if they bring it up, or they're going to say or do the wrong thing and just make matters worse. But I will say that saying nothing is actually precisely the wrong thing to say after a crisis, because it communicates to children that the adults are unaware, unconcerned, unable, or perhaps the worst, unwilling to be of assistance. And those aren't messages we want to say to kids when distressing situations are present. So what you want to do is anticipate some of the common reactions you're going to see to a crisis, and some of them are listed on this slide. These are reactions you'll see in students as well as in adults. And I will say that the most common reaction isn't on this slide, and that's nothing. So I just want to reiterate that most times you won't see anything, so please don't rely on signs or symptoms of adjustment reactions, but often base your support on what their experience, if you know their experience. We're going to talk more about bereavement next time, but if you know they've had the death of a close family member or friend, even if they look fine to you, you should still be reaching out to them and offering support. But let me go over some of the reactions that you may see after a crisis. So you may see fears, and in this case, it might be related to the pandemic itself, being afraid of becoming infected or infecting others. But you'll also see anxiety, and that could be fears that are not related to the specific crisis event. For example, in the middle of a pandemic, you may find that some kids and adults become more afraid of the dark. I mean, the virus doesn't affect you more in certain levels of light. If any. So it's the fear of dark is not because of the pandemic specific fear, but it is because, or maybe due to the pandemic, they become more fearful. And that's what the anxiety is. You also often see school avoidance after a crisis event, even if it isn't related to infectious diseases. We see it, for example, often after floods in communities. Children don't want to separate and go back to school after these natural disasters for fear that something may happen if their parents aren't there to protect them, or that something might happen instead if they're not somehow there to protect their parents. But during this pandemic, after sheltering at home for an extended period with remote education, children may be reluctant to return to school because they may be afraid to return to public spaces while the virus is still circulating. I mean, we've made such emphasis about how it's not safe to go out in public because of the virus, and then we're going to tell children at some point, well, now you should go back to school, it's fine. And kids are going to be reluctant to do that, understandably, and to a large degree, their parents are going to be reluctant to send them. So I think it's going to be really important that we reach out to students who don't return to class, because those are the ones who may be in the most distress, not just because of their concerns about the pandemic, but because of their emotional health as well. School avoidance is a sign of significant anxiety and distress. But we should also be reaching out to these students before school reopens. So if you already have been doing virtual classes and the kids have not been participating, that is a time to reach out to them and to their parents to just inquire how they're doing more broadly, or connecting them with mental health providers in the school or in the community, or connecting them with their pediatrician or other pediatric health care provider, just to find out remotely how are they doing, if they haven't been participating, or if they've been participating but not engaging in the level that you're used to with them. One of my biggest concerns is that when school resumes in September, if we put kids in new classes with teachers or educators and staff that they haven't met before, it's going to be even harder to figure out how they're doing, because you won't have the pre-existing relationship in the sense of how they were functioning prior to this event. So I am encouraging school staff to figure out how to stay connected with their students and with each other, even during the summer break, even if it has no academic component to it. Even if it's just checking in, having a chat, doing icebreakers, contacting students at the beginning of August to say, hey, you're going to be in my class, let's get to know each other a little bit. Even if kids return to school, there are some situations where they will not either be necessarily starting school with regular classes, or they may have more of a hybrid where they are participating in in-person classes maybe only 1 or 2 days a week, and then doing the rest virtually. And it's going to be hard for these teachers to get to know these kids. So I think we have to put extra effort into it. You can also see sleep problems, and that can be trouble falling asleep or staying asleep, difficulty waking in the morning, nightmares, or other disruption in sleep. And if people don't sleep well, they don't function well, whether it's academically or in their jobs. And so that becomes an important symptom. And this is actually one of the most common symptoms that we see. I see it after school shootings and natural disasters, and we're seeing it in the pandemic. It's all the more complicated because, particularly among adolescents, they often shift their schedules on the weekend and over summer vacations and in the holiday breaks, so that they stay up late and then sleep late. And some of that is, appropriate for adolescents because, and I would say during the pandemic, when you're sheltering in place and, for lack of a better term, you're stuck home with everyone, one way to physically and socially distance is to shift your sleep schedule so it isn't consistent with others in the household. I mean, teens do this all the time. Their parents go to sleep and then they start to become more active because that's when they can kind of be more independent, even though they're home. Well, you stick everyone in the home, they're going to shift their schedule some for that reason. So it becomes hard to know, are they doing this because in some ways it is socially adaptive, or are they doing it because they're depressed? Are they doing it because they're abusing substances and trying to avoid detection? Are they suicidal? So you see many reasons for sleep problems. But the most important thing is make sure that the sleep schedule is functional to what the child's expectations are. So it's not a problem necessarily if they stay up very late at night, if they don't need to wake up early in the morning, and they're not, but they are if they're doing remote classes. You can also see changes not only in sleep patterns, but also in diet. And so they may have a difference in their appetite or their eating. That's another sign that you can see. As already mentioned, you can have difficulties with concentration, and that leads to academic performance. Some of that due to sleep, some of that due to anxiety and stress. You can see sadness and depression. You can also see anger or irritability. When we would go into schools after school shootings, we generally didn't ask if the teachers were yelling at the students. We just assumed they were, and we would ask, is it improving? I mean, people become short-tempered when they're anxious. And individuals who are in crisis situations are often less tolerant of change and unpredictability or additional stress, but you're going to have all three of them in abundance in a crisis. So the fact that they have trouble with that is a problem. You may also see distrust and suspiciousness. And these reactions can challenge pre-existing relationships among friends, colleagues, and family members. And it also makes it very hard to form new relationships. So when students are placed in new classes with new teachers, if they're feeling anxious, distrustful, suspicious, is not a great recipe for forming good bonds with people. So you have to kind of work through that. You can also see a new onset or increase in alcohol and other substance use. So you have to make sure that you have substance abuse evaluation and treatment services as part of your recovery strategy. And you also need to be on the lookout for this. I would also caution people not to use alcohol as a way of socializing when they're in crisis, because it tends to have increased risk of more self-medication. So I know I was talking with one school district, and they said that, you know, while their school was closed, I think someone in the district office arranged for wine to be dropped off to the teachers' homes or delivered to them so they could kind of socialize with wine. And I kind of said, I really don't think that's a good idea. I'm not saying that people can't handle alcohol, but I would not encourage it. You know, I was in New Orleans on one visit after Katrina, and I had talked about this. And the mental health provider who was hosting my visit said that actually, you know, she told me while we were in the car afterwards, she said, look, you know, it was probably like about 2 or 3 weeks after Katrina. And my daughter called me on my cell to ask me where I was. And I said I was at happy hour with some of the people at school. And she said, Mom, you've been at happy hour every day since Katrina, and you don't seem happy at all to me. She said, and then I realized I was drinking a lot. So we see this among professionals, and I have seen staff get together for different crisis events, like after a school shooting, they'll get together at happy hour. And sometimes it leads to excessive drinking. So I'm making some emphasis about this because I think we have to be conscious that alcohol and other substance use, like self-medicating with marijuana, we have to be aware that that can get into situations where it becomes a problem in and of itself. And so we have to be looking at it not only in the kids, but also in the adults. You may also see physical symptoms, headaches, stomach aches, fatigue, and that may be due both to psychological distress presenting as physical problems, but stress hormones also cause physical problems. So that you might see an increase in blood pressure, increase in diabetes, problem with asthma, more asthma attacks due to the stress hormones themselves. So it's actually complicated that physical symptoms can be caused from increased illness, physical illness, but it also can be caused by mental health symptoms as well. Then we have grief, and I'm going to talk about grief on the next webinar, so I just want to put that as an important potential symptom. And the last one on this slide is just guilt. People somehow manage to feel reasons to feel guilty, irrespective of what actually has happened or their experience or role in that. And at some level, often unconsciously, it may actually even be easier to feel responsible for something you did, didn't do, or should have done that you thought could have prevented someone you care about from getting infected, ill, or having a serious outcome from the illness, than to actually accept the fact that actually you've had nothing to do with it. Because if you have nothing to do with what happened, then you can't prevent it from happening again. And that may just be intolerable to people, to feel that they're that powerless, that someone they know is in an intensive care unit with the COVID-19, and they couldn't do anything about that, which means someone else in their household or family or friendship network may also be similarly at risk. So they, at least unconsciously, prefer to feel guilty because it gives them the illusion of control. But I want to emphasize that is an illusion of control, so it actually doesn't prevent anyone from getting ill. If it's just an illusion of control, if it's just unfounded guilt, it doesn't help with preventative actions, and it makes you feel guilty, and that impairs adjustment. So we have to deal with that as another symptom. I've even seen survivor guilt, or individuals who feel that somehow they've avoided experiencing the same loss or trauma of others, and they feel guilty that they actually have been lucky. And so people feel guilty for being lucky. I know that may not fit with the Las Vegas culture, but some people do feel guilty for being lucky in that sense. And you can even feel guilty for being viewed as a hero. You know, I'm a developmental behavioral pediatrician, so I work in pediatrics in a children's hospital. And, you know, I will say that people will, you know, say, you know, it's great you're on the front lines. Well, actually, most of the work I'm doing is remote, and I don't feel like I'm on the front lines. I'm working, I'm trying to do something which I think contributes, but sometimes it feels, you know, I have gotten things sent to me about how you can get free hotels. There are things that are being sent, you know, made available in terms of physical items for members of the children's hospital on the healthcare front line. I would never accept any of those. I don't feel deserving of that. But you can imagine, even if you worked in an intensive care unit for adults in the epicenter, in an epicenter of this, many of those patients are actually dying. And so for some people, they don't actually feel like heroes. They question if they failed, if they've done what they could do. A lot of it, we're still learning what to do, so it often feels like you've made mistakes or you've failed to achieve what you were trained to do, and they may actually even resent a lot of national attention of being heroes. So I'm not saying we shouldn't be thanking people for their hard work and acknowledging this. And my colleagues are on the front line, and they're doing that even though it places themselves at risk of getting infected, you know, from the same virus. But you can imagine sometimes they even feel guilty for too much recognition of that. Now, these reactions may actually, all of the ones I've listed, may be due to the pandemic itself, or it may be due to a wide range of other stressors that are associated with the pandemic. For example, if there's a financial impact of unemployment or partial employment or being furloughed, that may cause concerns among parents, and those parental concerns may actually impact the children. Or it may lead to increased arguments among the adults in the household. It may worsen parental depression or anxiety or other mental illness or substance abuse among the parents or other adults in the household. May even increase the amount of domestic violence and child abuse. So during the pandemic, you shouldn't just be looking for children who've had a family member become ill or die, but you need to ask more broadly how they're doing and how the family is doing, because it may not actually be from the virus directly, it may be indirectly. So then these are some of the reactions. So now I thought what I would turn to is the question, what do we expect to see when schools do reopen? And then how can we prepare to meet those needs? So first, I'd like to emphasize the importance of addressing services through what we call in the school system a multi-tiered system of supports. And the predominant focus and activities should be delivered through the universal or what are called Tier 1 services. I think that's always the case, and that is what the model does say. But the pandemic underscores the validity of that perspective in particular. So to illustrate this, I'm going to share some of the findings of mental health needs of students that were seen 6 months after the World Trade Center attack in New York City. Part of the reason for doing that is we have that data, and it does show, for example, what you would expect 6 months later. And that 6 months is about the same time frame when schools are likely going to reopen in September if the pandemic started in March in many communities. So there was a needs assessment that was conducted 6 months after September 11th, 2001 by Applied Research and Consulting, Columbia University Mailman School of Public Health, and the New York State Psychiatric Institute. And they surveyed a representative of over 8,000 students in grades 4 through 12 attending New York City public schools. The student compliance rate was actually very high. It was about 92% because they used passive consent in the older grade levels. And among other variables, they surveyed children's self-reports of current mental health problems, as well as self-reported impairment in functioning. So children were felt to only have a probable psychiatric diagnosis only if they reported symptoms consistent with the diagnostic criteria in the DSM, and also if they self-reported impairment in functioning. So in some ways, it's a fairly conservative estimate of what you would see for probable psychiatric disorder. And this slide outlines some of the key findings related to probable psychiatric disorder. They found that 1 out of 4 children, or 27%, met criteria for one or more probable psychiatric disorder that they explored. And so the rates of PTSD, depression, agoraphobia, which is the fear of open spaces, and separation anxiety were 2 or more times higher than rates in US communities that were surveyed prior to September 11th, 2001. So approximately 1 out of 10 of the students, and understand these again were over 8,000 students throughout all 5 boroughs in New York City. And they found that about over 1 out of 10, or approximately 1 out of 10, had PTSD, major depressive disorder, separation anxiety disorder, and panic attacks. And 15% agoraphobia or fear of going out or taking public transportation. Now that 15% compared to a baseline rate in another community of 5%. It was a 3-fold increase. And I think that was due not only to the World Trade Center attack itself, but also ongoing concerns of terrorism that were present in New York City after 9/11, and also that terrorism include anthrax attacks. So that was another infectious agent that was dispersed silently throughout the community. And so I think this is probably the closest we have for data in the United States that would be comparable to this pandemic. So I don't know exactly what we're going to see in terms of the impact on children's mental health, but I think we will see, for example, a similar type of increase in children's fears of leaving home and re-entering public spaces such as schools and transportation to get to those schools. And I will say that we have some preliminary data from certain parts of China that were most impacted, where kids were sheltering in place. And we're seeing we saw there increases in anxiety and depression. Now, beyond the high prevalence of probable psychiatric disorder, what was also shown was that adjustment problems persisting 6 months afterwards were nearly universal. 87% of students reported at least one PTSD symptom 6 months later. 76% reported often thinking about the World Trade Center attacks, and 45% reported trying to avoid thinking, hearing, or talking about it. 25% still found it hard to keep their mind on things, and 24% were having problems sleeping, 17% having nightmares. And 18% had stopped going to places or doing things that reminded them of the events on 9/11. And 11% of the students reported at least 6 of the PTSD symptoms, and that was what was felt needed to meet diagnostic criteria for PTSD. Now, I do want to note that these same adjustment problems can be seen in other mental health conditions and can be seen in bereavement, which isn't a mental illness. So sleep problems, nightmares, difficulty concentrating are seen in bereavement. They're also seen in depression and anxiety. So while they were referred to as trauma symptoms by the authors of the paper, I think it actually best to view them as adjustment challenges or problems or reactions. And by the way, I think we often call things trauma when it really is from a range of other situations. Now, at least 2/3 of the children that had what was felt to be probable PTSD that still had problems 6 months later had reported that they had not sought any mental health services from mental health providers, either within or outside of the school. So these findings show us that after a major crisis event, adjustment difficulties will be pervasive and long-term and persistent. In most cases, kids are not going to receive traditional mental health treatment. Now, in New York City, I worked closely with them for a couple of years after 9/11. They actually had a free counselor in every school within the New York City Department of Ed, with funding that they got from FEMA through Project Liberty. You're not going to see that level of funding after the pandemic. And I know that in the Las Vegas area, it isn't the most robust mental health system to begin with. And I think it's going to be stretched very thin by the financial impact of the pandemic, and it's going to be hard just to maintain services. I don't think we can anticipate a lot of external funding and support to enhance it, unfortunately. So, not trying to depress everyone, but I think it underscores the need to shift from an exclusively medical model. And I hear that a lot, particularly in trauma. What we need to do is screen, evaluate, diagnose, refer, and treat individual students who have a mental illness. We have to move more towards a system of universal support as the primary response after a pandemic. and focus on building resilience rather than just delivering treatment. Now, that has to be coupled with incorporating school mental health and community mental health professionals to provide additional support and services to children who require more. That's, your tier 2 services, for example, as well as more intensive services for tier 3. But much of tier 3 is going to really have to be provided, I think, through community-based mental health providers, simply because it's going to take so much to do the tier 1 and tier 2 services. Schools may not be able to do that, much more than that. So let me turn to now some basic advice on how to talk to and support children during the pandemic before I turn to professional self-care. So this is basic advice that you can share with staff and with families. So first, don't pretend that everything's okay when it just clearly isn't. Children can pick up when parents and other adults are not being genuine and honest, and they're going to be less likely to ask questions or seek advice from people who they don't believe are being genuine and honest. Children actually benefit from knowing parents and other important adults in their lives, such as educators, have similar or at least their own concerns. And most importantly, they need to use them as models for effectively coping with troubling or distressing feelings. So they have to see how they're doing it and succeeding. We can't expect children to share their concerns when we're unwilling to even admit that we have concerns ourselves. And we can't help them learn how to cope with distress if we don't model effective coping techniques for them. But this doesn't mean that the adults should share all of their concerns. Some concerns are really primarily those of adults, such as related to the impact on employment or income of parents and extended family members. And parents should try and discuss those concerns privately. If children do pick up on them because they hear about them in the news or they overhear a conversation, then parents should share reassuring information that helps place the financial concerns in a context relevant to the child. So for example, you might say, with all that's going on, it's no longer a good time for us to buy a new television or get a new car, but don't worry, we have enough money saved that we can meet our daily living expenses. If a child just hears we can't afford things, they may worry that you can't afford food. Now, in some families, financial concerns were a significant issue prior to the pandemic, and they're even worse now. And so in discussion with kids, in general, though, try to focus on what you honestly can provide. You have to be honest, rather than on what you may not be able to pay for, particularly if the situation worsens. So I wouldn't talk to a young child and say, look, based on the drop in the stock market, stock market's doing okay now, but if it does drop again, I wouldn't just say it just wiped out your college fund, because that is really an adult concern, and you have time to deal with that if it's a young child. You may be worried about it as an adult, but I wouldn't share that concern with the child. There's nothing they're going to be able to do for your investment portfolio. And so telling them that is just going to be worrisome. What you want to do is actually find out what the individual's child's fears, concerns, or skepticism is. Children generally have very different fears or concerns than the adults around them. And you can't reassure people if you don't actually know what they're afraid of. If you don't know what they're concerned about and you give advice, you're not probably giving reassurance, but rather you're telling people why you aren't worried. And when each person talks only from their own perspective, in the mental health field, we call that arguing, and that is not very reassuring to people. And it's not very gratifying either for people in the conversation. You don't want to tell children that they shouldn't be worried or try and minimize the concerns that they do voice. Instead, help them learn to deal with their uncertainty and fear, and share with them strategies to deal with distressing feelings rather than pretending they don't or shouldn't exist. And be sure to include positive or reassuring information and present overall a hopeful perspective. This is not actually a good time to convey to children a strong criticism of the government's response to date or your candid assessment of the leadership of those in public office, unless your children are seeking practical advice on how they should vote in November. But if they're not voting in November, we want to give them, they can't control who's elected, so we want to give them some sense of faith that those who are in positions who are making decisions will make competent decisions, even if you don't really think it's been done very well so far. So try and convey that you hope and expect that scientists and public health officials as a group are learning how best to handle the situation, and that you expect your community, your state, and your country will ultimately make decisions to address the pandemic effectively. Now, as I said, you want to explore with children different strategies of dealing with distress, discomfort, anxiety, and sadness. And that might include such things as reading or hobbies that promote healthy distraction, and talking to others, journaling or blogging or art and music to promote the expression of feelings. You actually need to do both. Sometimes you need to distance yourself from your concerns, and other times you need to manage those concerns and face them. As you can imagine, though, people do that in different ways and in different schedules. And if you're all together in one household continuously and one person wants to talk and the other person wants to distance themselves, that can cause conflict. So you just have to be aware that both are right, but you may not be in sync with how you're doing it. You can use such techniques as exercise and yoga, appropriate use of respectful humor, relaxation techniques and mindfulness, and that can be taught even to very young children. And there are some techniques that do require additional training to teach, like self-hypnosis and guided imagery that can deal with anxiety, and cognitive behavioral therapy and therapeutic approaches, which help children replace some of their negative thoughts with more positive interpretations, which in turn affects the feelings and ultimately their behaviors. Now, many of these techniques can and should be learned before children are experiencing high levels of distress or anxiety, because they involve practice and coaching, and it's easier to learn them when you're not distressed. But actually, the principles can be introduced and basic skills learned even in the midst of a pandemic. You also want to help children identify developmentally appropriate steps they can take personally to both protect their own health and to protect the health of others. So for young children, for example, maybe just let them pick out the soap they prefer to use to wash their hands if you have more than one choice. There are restrictions in some of what we can buy. You may also want to help them or allow them to pick their own routine for washing their hands, such as let them pick what song they want to sing. I'm not trying to be critical, but quite honestly, if someone is quarantined at home during their birthday and they're not able to see their friends or family members. My daughter just had her birthday yesterday, and she was just with my wife and me. And so she actually asked us not to sing happy birthday. My child is an adult, and she's lives out of state and is just home during this. But you can imagine if you're a young child and you can't even celebrate your birthday, probably the last thing you want to sing every time you wash your hands multiple times a day is happy birthday. It's probably not a good choice. So let them pick what they want to sing, because we have to teach the kids safe self-management skills for this, because they're going to eventually go into public spaces like school. We're not going to be there to sing along with them or remind them to keep their mask on or tell them you're getting too close to someone. They need to learn to manage their self skills that they have to learn. You can identify ways for older children to safely help others, such as dropping off food outside the front door of people's homes who can't go out, or just having them make regular phone calls to speak with grandparents or other elderly people who may otherwise feel very socially isolated. Now, if children can contribute to the response, they're actually less likely to feel helpless, and finding ways to help others gives some sense of agency to children during a time when they would otherwise feel pretty powerless. Now, not everyone, I've been talking about tier 1 supports, but there are going to be some children who need more assistance. And the pandemic and discussion about the impact on families may remind children and adults of other difficulties in their lives, whether that be events in the past, ongoing challenges, or concerns about future losses or crisis. And these children may find it particularly difficult. Children who were anxious or depressed before the pandemic are likely going to need even more support. So encourage families to reach out to their mental health and pediatric healthcare providers by phone and email to get that advice and support. Now, when children are highly stressed, they may regress socially or act less mature. So they may become more demanding, more selfish, or have more difficulty getting along with peers or family members. Some children may also just appear disinterested because they're overwhelmed with their own concerns. They may need to focus first on their own needs. What does this mean for their college plans, their vacation, their sports or hobbies, their relationship with friends, their birthday, before they're able to start to think of the needs of others. Sometimes this makes parents think that their kids are self-centered and uncaring and non-empathic, but it may actually be a sign that they're under stress and they're just having difficulty coping. So try really hard not to make them feel guilty for thinking about and sharing their distress about how the crisis impacts them personally, even if it pales in comparison to what's happening to others. So you can imagine a child saying, it's not fair, I don't get to go out and celebrate my birthday with my friends or go to graduation. And a parent would say, well, there's some people who have had deaths that occur in their family members. You should feel grateful. Well, they don't feel grateful. And when you say that, they just feel guilty. You've kind of shamed them. And you're not helping them feel any better about what they've lost. The fact that somebody has it worse doesn't make it any easier for them. And it just makes it less likely they're ever going to share with you their concerns again. So why would adults do that? Well, adults do it because they go through the same social regression and they're under the stress that the kids are under, and they're probably not doing their best. Crisis response can bring out the best in people, but quite honestly, it usually brings out their stress. And we likely won't be at our best all the time. And frankly, being around people who are needy, demanding, self-centered, and distressed isn't fun or particularly satisfying for anyone. So we have to try and be patient with children, with their families, with the adults that we work with the adults we live with, and above all, we have to be patient with ourselves. And I'm going to turn to professional self-care shortly. So that's what I wanted to spend the remaining time on, and then I'm going to turn it over to questions and discussion. We have to realize what impact all of this has on us as adults. Educators and other school staff and mental health providers and medical providers, we all have our own concerns about our health or those of family member and friends, and you really have to make sure you're attending to that as well. Don't just focus on the needs of children. School staff are most likely to feel overwhelmed when they feel unable or unprepared to provide assistance. There's actually a lot we can do even in the midst of an evolving pandemic. We certainly can acknowledge the limitations in our current knowledge and the resources that we have, but we shouldn't minimize the value of our guidance and the assistance we can and do provide. Just because we don't know everything doesn't mean we know nothing of value. You all know strategies that have helped in the past to decrease students and adults' distress, so try some of them now. You may not feel that what you can offer, especially remotely, is enough, and children may want, and sometimes they even may need, more than you can provide. Reach out in those situations to colleagues and resources in school, school district, and the community when you feel more is critically needed. But all of us should try to recognize and celebrate positive contributions you do make every day. The moments you're able to help a child smile, even if it's only for a moment, or help them learn something so they feel some sense of accomplishment when they otherwise would just feel overwhelmed. Now, I've worked with a lot of healthcare providers, for example, in the aftermath of some devastating disasters. And a common reaction I get is that they feel helpless and they wonder if they're making any positive impact for their patients and their families. And I suggest that they periodically huddle as a team, not just to identify ongoing problems, but also to identify and share some of their small successes. So you want to try and do that yourself, is figure out what it is that you're doing and then celebrate it and share that with others. I think we also have to try to set reasonable expectations and communicate this to children, parents, educators, and other school staff. Frankly, children are not going to learn as much schoolwork during this time period as they would have had we been able to keep schools in session and we weren't in crisis. I hear everybody talking about how we're losing, how we're sliding behind. Yes, we're in crisis. That is what happens. We shouldn't be spending so much time talking about the fact that, yes, that's what's going to occur. And I wouldn't try and keep the same pace of learning, or this is just going to overwhelm students and educators. And then the time they have together is just going to be a source of stress rather than a source of assistance. And I'm warning everyone now that when schools do resume, you're not going to catch up and teach everything you miss. There's just no way you can catch up on months of missed work and expect kids, when they're still stressed and overwhelmed and the teachers are stressed, to teach at an accelerated rate of learning than they were when they weren't stressed, so that they can do twice as much. There's no way that's going to happen, so we shouldn't even be trying to set that up as an expectation. We have to recognize that at some level the curriculum has changed. If we're teaching children now how to cope with distress and adjust to a crisis, then we're helping them learn life skills, and that's going to make them more resilient in the future and more capable of dealing with future adversity in their lives. And to be honest, those are the lessons that are most important. They are also difficult lessons that are generally not learned easily or quickly. So before I just go to professional self-care, I'm not going to spend very much time on this slide. It really talks about adjustment over time. We don't have a baseline to begin with that's a straight line. So we always had times where we were in more distress or coping better. Just when you see people in distress, it does not mean they're in crisis. Crisis is not actually defined by the event, it's defined by the individual or system's capacity to cope with the event in the absence of external support. People who are resilient, and this is an important point, are not people who don't experience distress. They're only people who learn how to cope with it themselves. So you should still provide support and assistance and compassion to people who are in distress, even if they're not necessarily in crisis. But then a crisis event occurs at point B, and then at point C, they're overwhelmed, and at point D, their usual coping mechanisms have failed. And that's when communities usually come together, they provide assistance and support, they help each other. We often call that the honeymoon phase because it's the same thing that happens after marriage or weddings. People come together, they bring food, money, they share food together, and they socialize. But we're not able to do that now. And one of the things that I'm trying to underscore when I talk with people is everyone assumes we're in the recovery phase. We're still in response. This pandemic is still occurring. We may wish it not to be. We may have moments where we think it's better, but it's not done. And so you're not actually in the recovery phase yet. You're still in the midst of the crisis. But when we start to see some improved functioning, some people feel really helpless and hopeless at that point. They look around, they see other people who they assume are doing better because they look like they're doing better. Because again, you can't tell how people are feeling. And they may conclude that they're never going to be as good as the people around them. That's when self-harm occurs more. It's not actually during the worst parts of the crisis. It's usually during the recovery period over weeks and months. But if we withdraw the support too soon, then what happens is some people don't get back to their baseline and they just have continued impairment. And we need to go beyond that point until most people are back at their baseline. And some individuals will surpass their baseline. We call that post-traumatic growth. They may emerge from these events with a new sense of purpose, more committed to help others, higher degrees of empathy, spirituality, etc. So I often tell this story. I was talking with a group of foster parents after a large natural disaster. And one of the foster fathers said, I think I must have had post-traumatic growth. He was actually working in finance, I think on Wall Street. And he was young, he was successful, he was happily married, he had a toddler, everything seemed perfect. And then the toddler got an infection and died. And he said all of a sudden he questioned everything, including his career. I'm not trying to make a judgment of people who work in business or finance, but he said that he questioned if he was really making a contribution to society. So I was making money, but was I really helping society be a better place? So he said, even though he was successful, he quit his job in finance and went back to college to become a kindergarten teacher. He said, shaping the lives of a young child, that is a career. Finance for him was a job. And so, and he became a foster parent and he was adopting a child when I was speaking with him. So he probably did have post-traumatic growth. And I will say that a lot of people who are in education, in pediatrics, in nursing, in mental health, in bereavement, and all of the people who have devoted their lives to help others usually do it because someone helped them, often when they were a child, or someone failed to. And they want to make sure no child has to go through that again. But the reason I'm going through this before I talk about professional self-care is the people who are compassionate and are there to help others are the ones most likely to be hurt by doing it. Because if you have an event that you go through, even vicariously through someone else, it reminds you of your own losses and stresses in your own life. So those in helping professions are therefore more likely to be heard by helping others, but they're the ones who you want to be in the profession because they can. I always tell people you can't have compassion fatigue if you're not compassionate, but we really shouldn't have kids surrounded by people who don't care, who are non-empathic and not compassionate. So let me just end by talking about that. So I want to start with compassion fatigue. An exposure to the trauma and suffering of others can lead to compassion fatigue. So empathy involves understanding and taking the perspective of another person, but compassion requires that empathy, but includes the additional step of wanting to help and or desiring to relieve the suffering of another. So the word compassion has two Latin roots, which mean to bear or suffer together. And this element of sharing someone else's suffering is usually accompanied with warnings about compassion fatigue, which somehow tend to imply to people that compassion is necessarily tiring. And it's as if we were just born with a fixed amount of compassion and you run out of it if you care too much or for too many people. But what I hope to end with is that compassionate approaches can actually be gratifying and therefore bring meaning to the work that we do. And that actually helps prevent burnout. But this is most likely to occur when staff have realistic objectives of the purpose of their interactions. For example, if you're supporting someone who's grieving or coping after a disaster, the goal is not to take away their distress, but rather to help them begin to cope with it. You also need to feel that you have the skills and the resources to provide some of that meaningful assistance. You have to be allowed and empowered to provide that support, and you have to be aware of and have sufficient support to deal with the personal impact on yourself. But professional self-care is not just dealing with the personal impact on you, it's also making sure you're in an environment that does support you. Now, compassion does require more emotional effort, but just as physical exercise can be tiring in the near term, but ultimately energizing and increase the capacity for subsequent exercise, the capacity to provide professional care can increase with practice. And as I said, it can be gratifying and bring meaning to the work that you do. Staff should also be aware that hearing the trauma stories of individuals who are impacted by crisis events such as the pandemic, when we are compassionate, can transmit some of the trauma to the helper. And that's what we call vicarious traumatization. Educators and school staff should appreciate that their role is to be supportive and to help children connect with professionals that can help children process their trauma and loss. And it isn't necessary for classroom educators and school staff to listen to their full stories in order to do that. In fact, it's probably not in the best interest of the staff or of the children. Now, if you are running a group for counseling or you're providing bereavement support, then yes, you do listen to those stories. But that's what you're trained to do, and you get additional supports for it. But if you're a classroom educator, your goal is to help them get to where they can get the support and be supportive and considerate of them. Now, delivering compassionate care does require concerted effort in any context, but it's especially difficult in the context of a pandemic when you've got physical distancing and we all have other challenges, worrying about how to get food, taking care of your own parents, etc. And if you're also working from home for professionals and you're providing care and supervision and instructional support to your children, it may be very difficult to try and do all of your work during working hours. And I find that professionals are pausing during the middle of their workday to make sure their kids have food, to make sure that their kids are on track with their lessons, to take care of another relative. And then they feel compelled to make that up in the evening and weekends because they weren't working all their working hours, so they need to work in the outside those hours. And it's hard to manage your time in this context, but I will tell you it's impossible to create time. So there's only so many hours in the day. And if you try and do more than you can physically accomplish while you're awake, the option of decreasing sleep does not work well, either on the short term or on the long term. And it doesn't provide the time for rest and renewal, which is part of what self-care requires. So you need to set priorities. and I would prioritize what's important and just aim to accomplish those on the top of the list most of the time. And I know some people do that, but they tend to never remove what's lower on the list. So it's all just there, waiting for you to catch up, and you're not going to catch up. And that just causes some more distress. So you have to eliminate some things lower on the list. And I will just tell you, for those who are working at home, from home, all this discussion about these do your rainy day activities, these are the times to learn a new language or something. That's for the people who are not, struggling with finishing their work. And so set reasonable expectations for yourself. And just realize, take simple steps. So don't try and keep your house clean enough that it's not unhealthy, but don't spend a lot of time keeping it perfectly organized. And just don't judge yourself as failing if you don't live up to unreasonable expectations. Just consider yourself wise. Now, I would say you should address those issues with the highest priority, but go out of order sometimes. If you only try and address the most pressing needs, you're never going to get to many of the needs of your children, most of the needs of your spouse or significant other, and virtually all of your own needs. So you have to go out of order. Talk to your kids and find out what's really important to them, even if it doesn't seem like it's that much of a pressing need objectively, and do some of those things for them. Talk to your spouse and significant other, but most importantly and most overlooked, develop some insight into what's important to you and take care of some of those, so that you're still able to attend to the needs of others. So I think I just have 1 or 2 slides left. And so we want to make sure that we recognize there are going to be challenges to professional self-care. One is allocating time when there's so much to do and everyone needs your help. And so what you have to do is allocate time. You can't just wait to find it. Feeling shame or guilt for attending to your own needs ahead of those of others. And again, you're not putting your needs ahead of others. You're just taking care of your needs so you can help others. Assuming others are having less trouble adjusting than you. And as I said, people don't seem to have the distress. You don't see the distress. So don't assume that just because everyone looks okay, that they are actually not having difficulty or challenges. And then a lack of modeling of professional self-care by everyone around you is another barrier. And so practice self-care and share it with others so that you can help them take care of themselves. I'm actually, just in the interest of time, going to skip this slide in case people have questions. But this is just talking about some of the unique challenges of leadership. And if people have questions on that, we can go back to the slide. But I just want to say that when we start to move into the recovery period and start to reopen schools, you are going to find that there's going to be a lot of disagreement and anger, and a lot of parents may seem unreasonable, and adults and staff may have disagreements about how we're going to maintain safety, how we're going to use the limited funding that we have, and all of that distress is going to come out, and we're going to see, probably a lot more fighting and disagreement. So I'm just going to end there and mention that this is where you can get more information about the National Center for School Crisis and Bereavement. And you'll see kind of a salmon banner that's about 1/3 of the way down on this slide. It's actually near the top of the website. And it's a COVID-19 pandemic resources webpage. We have presentations there for parents and educators on how to talk to and support kids. A number of videos and a couple articles. So you're welcome to turn to that for resources. And there is a particular resource there on supporting grieving students during the pandemic. We're going to be going over that when we get back together in 2 weeks. And this is information on how you can reach me and the National Center. So I'll just stop there and see what questions we might have from people who participated. And thank you for your attention. And I think Beth and Kelly, you may actually want to, I think you want to talk a little bit about Adam's place. So let me just advance the slide so you can summarize some of that for people before we open it up to questions.
Thank you, David. and thank you for sharing all this great information and giving us a permission to have some self-care and start looking at ahead of what challenges we have during the pandemic, not just the recovery, but during this period as we take our next steps to re-engage in the school system. We just wanted to let people know that we have been running virtual groups with children, and they have done well. We are from ages 5 on up. We have been training facilitators virtually, giving families orientation virtually. So we have added that platform to what we do. Our last session will be next Tuesday for a virtual support group. We just took our Camp Hope curriculum and laid that out there on our platform and sent activities for the kids in order to share during the virtual meeting. We've trained new facilitators through virtually. So we've added the platform, but we do look forward to be on campuses this fall, and we will be waiting to see how the school district unfolds, what that could look like. We have 9 agreements that we will be on your school campuses this fall. We hope if we can secure funding and everything falls into place, we could be in more schools in order to be your partner in helping children cope with change and loss and grief. We'll continue having webinars that offer education, training, spotlighting areas that we hope you'll find helpful. We have a short survey that we're sending out at the conclusion after questions and answers to get some feedback and to get ideas on other topics you may want to hear about. But we're here to be connected with you and provide the training and education and have consistent communication. So our newsletters are going out weekly, and we're just pushing out what we can. And please do take good care. We need everyone to be able to be present when we go back to school, because we know the anxiety will be up. And but thank you. We are also moving. I'll add that too, so that our group rooms will have more physical space. So if we do go back and have group meetings in person, that we will have social distancing and enough space for the children and facilitators. So we're in process of moving, and we'll be sharing that information July 1st. So thank you everyone for participating today. And David, what a great job, practical information and digestible information. And I think all of us really need to be able to have that diet of good information coming in, and we appreciate you.
I don't know if anyone has questions or they wanted to discuss anything. We do have some time still. I do see some question about whether I've written a book. I can say that there's a book that I have written. It's Supporting the Grieving Student, and it's a really guide for educators. And that book, we actually just started working now on the next edition of the book, but it is available through Brooks Publishing, Supporting the Grieving Student. I have written a number of articles that you can also find some of them on the National Center's website, which is schoolcrisiscenter.org, and you'll be able to download some articles about providing psychosocial support to children after disasters. I haven't written a book on that, but there are a number of articles and guidelines that you'll find there.
Thank you. Thank you very much. I don't know if you can hear me, but wonderful delivery and information, and very informative and very helpful, and appreciated.
Well, thank you.
Doctor, I have a question.
Yes.
One of the things that really resonated with me that you had talked about is how we tell children, you know, don't worry. And I think it's just such a standard, like it's an auto response to so many things, not only with children, but adults too. Can you give me maybe an example of how you would respond, or how you would get them talking, or to kind of alleviate their fear in kind of like a one little snippet?
Sure. Well, I first have to make a great point that it is a natural reaction. So I have done it myself. Even though I tell people not to do it, I have done it. So I remember once coming home from work, and one of my daughters was just looking, I think she was in junior high or maybe high school, and she just was looking upset or not. Something was bothering her. So I just said, what's going on? And she looked at me and she goes, I'm depressed. And I looked at her and I go, you're not depressed, dear. And she just looked at me and said, how do you know I'm not depressed? And I said, well, I guess I don't know. I guess what I meant to say was, I would hope you wouldn't be depressed. It would bother me if you're depressed. And she said, well, it bothers me that I'm depressed too. But if it bothers you so much that you don't want to talk about it, then I won't bother you with it. But you offered to help, and you can't really help if you're not willing to see me as being depressed. So I said, okay, that's an excellent point. I made a mistake. Kids will be forgiving if you're genuine and honest and you're trying to help. I said, it does bother me if you're feeling depressed, but I do want to help. And so I asked her what was going on. Now, she had gotten into an argument with a friend or some disagreement or conflict, and she looked at me and she goes, well, I'm not clinically depressed. And I really wanted to say that's what I meant, but that wasn't the point. And I said, well, I'm glad to hear that. But we both learned something here, because yes, it would bother me if you were depressed, but it would bother me even more if I didn't know that, because then I couldn't help you, and that would be more bothersome. So I always want to invite you to tell me when there is something that bothers you, even if that makes me uncomfortable, because not being able to do that would make me even more uncomfortable. Now, she's actually as a therapist now, so she's been very good at communicating how she's felt, and we've had that open communication and continue to do so. So I think what you just have to say to kids is, I'm here for you. And even if it's uncomfortable to talk about it, it's more uncomfortable not to talk about it. And I'm willing to be uncomfortable, because that's what I want to do. It's very important to me. And so some of it is what you say, some of it is how you act, but you just want your kids to know, I'm here for you. And when you're ready to talk, I'll talk about it with you. Now, there may be some things that they don't want to talk with you about for whatever reason. Maybe about you, maybe about their worries about disappointing you, for example. Maybe they're just not ready to have that conversation. And so what you can also do is say, who can you talk with? Or who can you talk to when you're ready to talk about it? And I also think, we invite people to talk, but it's an invitation, and kids have to accept the invitation. And so I think what you need to do is just kind of, tell them, I'm here when you're ready to talk about it, and I'll keep checking in. I'll understand if you're ready, but let's think about who else you can talk to. Do you have a friend you can talk to about some of these things? Do you have someone at school that you can talk with? Can I help find someone that you can talk with if it's more comfortable for you? But I think the way we get our kids to talk with us is by talking to them. And also, I've shared with my kids concerns that we've had that have been very serious concerns. I've shared it right when I find out. Had one situation where I shared with my kids something that was very difficult, and it turned out to be false. And then I remember saying to my kids, maybe I shouldn't have shared that. And my kids just looked at me and they were like, of course, if it worries you, we should know about it. I'm glad it wasn't true, but we always have to know that we can count on you to be honest with us. And actually they looked at me and said, to think that you would purposely withhold something, that is very upsetting. And I said, no, I won't. But, I wonder if it was the right decision. They go, of course it was the right decision. So I think what you do need to do is just be honest and genuine with your kids. But that doesn't mean sharing every detail with them. But just they need to know what's going on. And then they'll know they can count on you for an accurate source of information. So I don't know if that answers the question, but.
Thank you.
Yeah.
Hello, can you hear me?
Yes, I can.
Hi, my name is Jasmine. I'm a social worker at an elementary school. And you talked about teachers, the role of teachers in situations like this is to point them in the right direction to get additional support. Would you say that it's good for teachers to also be trained in psychological first aid? Because you also talked about we should only do it or engage in psychological first aid with students if we're trained. And if they don't have the right interaction or the right conversations with the right individuals, it can do more harm than good?
So I recommend actually everyone be trained in psychological first aid. That's why it's called first aid. These are basic skills, and people who are trained, like even under FEMA funding, under the crisis counseling program after mass disasters, the psychological first aid the training goes to lay people. So it is not an advanced skill. And so I think we should be able to, observe, listen, be supportive and empathic. Like everyone should have those basic skills. What I was saying is that if you're discussing the trauma narratives, you're actually talking, if a child says, I watched something, it was very scary, my mom got hit by my dad, then that's probably all the teacher needs to know about it to go get someone like you. I wouldn't recommend they sit down and tell me, tell me exactly what you saw, what did you feel like, and, talk at length with them about it. Because if individuals share their trauma narrative and then that person can't help them process it, and then they have to share it again with another person, that isn't usually as helpful. And for some people, we see this after really horrific events like mass shootings. We've had situations where staff at the school have shared the witnessing of murder of children in large numbers, even with some mental health staff, and the mental health staff start crying or say, stop, I can't handle it. And that's not helpful, that's not good. And so you don't want the children, you don't want to try and process the trauma with them if you don't have the training for that. And for protection of themselves, they don't want to hear all of the details. I'll say I go to schools after some, really horrific events, some of the largest mass shootings in the world. And I don't tell my family some of the things that are shared with me. And quite honestly, I often don't even ask for details about what's happened because I'm not processing their trauma with them. I'm helping them figure out how to respond as a system. And so I'm probably one of the few people in the United States who has not actually watched the video from Columbine, who doesn't listen to the 911 tapes, who does, because I'm in these events and to a certain degree, I don't really need to know every detail. And I think if I did know all of it, I may go from one crisis event to another, and it can just get very overwhelming. So I do think psychological first aid is useful for everyone to know their basic skills. And I don't think educators should avoid reaching out to kids and connecting them with the support they need. I'm just really talking about trying to provide trauma treatment when you're not trained in treatment, or management of suicidality when you're not trained in doing that.
Got it. Thank you for clarifying that. It will help me with responding to teachers that say, well, I don't need that training, I'm not a counselor. And now I'll be able to explain the difference to them the way you explained it. It's basic first aid, psychological first aid.
And that's why, that's what I always tell teachers, and we'll talk about this more when we talk about bereavement next time, that we're not asking them to do bereavement counseling. We're just asking them to be sensitive that someone has died in their life. And they may be focusing on, how do I help you learn in that setting? How do I give you academic supports and accommodations? So they're not trying to provide the counseling skills, but they should be empathic. Everyone should be. That's why I use the example of someone who cuts the lawn at a national park. I mean, if they have some degree of sensitivity to people there, I'm not, we should be able to integrate that into our jobs as well. I think everybody can do that and ought to do it.
And I'll add that I'm trained to certify others in mental health first aid. And mental health first aid has been there's been a big push, just like with CPR, so that all folks in an environment can render basic mental first aid that are on site or in a given situation. So we infuse a lot of those techniques through our facilitator training too, so that but I think it's great that I think engaging teachers in mental health first aid and helping them understand what confidence and sensitivity that could help them with in the classroom.
Yeah. And just as a point of clarification, mental health first aid is different than psychological first aid.
Okay, thank you.
And it's actually a level higher. So psychological first aid is skills that lay people should have, and it really looks at reactions. Mental health first aid starts to do more training on what are the signs and symptoms of mental illness, not just reactions, but mental illness, and then what you can do to support kids. So the mental health first aid training is more extensive than psychological first aid. It may be for the same audience, but so I don't know that I would recommend necessarily every person in the country have mental health first aid training, because it's, and you can tell me, Kelly, how many hours the training is?
It's an 8-hour training that's good for 3 years. Yeah.
Yeah, so it is a higher level of training. So I would suggest psychological first aid to everyone who works in school, and mental health first aid for those who want to know more, and perhaps for educators. But you wouldn't necessarily have your custodian get mental health first aid training, but you can have them get psychological first aid training. So they're a little bit different, but yes, I agree that you do want your educators to have 8 hours of training may sound like a lot for an educator, but educators get a lot of training, and quite honestly, they deliver a lot. So they have a very important role in kids' lives, and I think some of this should be integrated into schools of education for pre-service training.
Yes. Yeah.
But I just wanted to clarify, they are a little bit different.
Thank you.
So I don't know if there are any other questions, but I'll leave it up to you, Kelly and Beth.
Well, thank you, David, again. This was great. We're getting great comments, and this is a wonderful food for thought. And we will look forward to seeing you again on June 24th, the same time at 10 a.m. And maybe we'll have the screen so we can see each other.
We'll have it all worked out.
Yes. So thank you for bearing with us, and thank you for connecting with us today. And everyone take good care and stay healthy and stay safe.
Thanks very much.
Thank you.
Thank you.